Hello, I'm Dr. Lynn. I am a chiropractor with a super fun specialty. I get to help parents and babies to breastfeed better. It doesn't get much better than that. I'm a lactation educator also, and I'm this close to my IBCLC, which means a board certified lactation consultant. I'm an international speaker, researcher, teacher, and I'm an absolute anatomy geek. I love explaining feeding challenges and just health challenges in general, simply by understanding anatomy and neurology and the body. So welcome to this week's edition called What Is and Is Not a Tongue Tie. Okay, so if you're tuning in on this subject of breastfeeding challenges, then you've definitely heard of a tongue tie, and you may have noticed all the controversy on this topic recently. So to just put it simply in layman's terms, a tongue tie is when that little flap of skin underneath the tongue, it can be at the lip and sometimes it can even be at the cheek, is too short, and it just doesn't let the tongue move the way that it's supposed to. In the past decade plus, say 10 or 15 years, the diagnosis of this fancy term is called Ankyloglossia, has increased by about 2,000%. Yes, you heard me, 2,000%. The medical profession is even starting to question if all of these diagnoses are correct and if the surgical release, this is where they cut that little flap of skin, is necessary. So recently, just back in July of 2024, the American Academy of Pediatrics put this article out, and it says, as you can see here, infants' tongue tie may be overdiagnosed and needlessly treated. Now, for all of you like me that love research, here's the reference for that article. The bottom line is this, and I pulled it out. It says, there are no uniform accepted diagnostic criteria for the diagnosis of ankyloglossia. So what that means, again, to the lay person is that the medical professionals like the lactation consultant, the pediatrician, the ENT, or the dentist that are checking for that tongue tie, they all likely have a different way of doing that. And it's all very subjective or open to opinion. So the question in my mind is always, is that frenulum actually too short? Or is the tongue not working right for other reasons? Here's another really cool study from 2019 that looked at what really is a genetically short frenulum and what is just a variation of normal. Dr. Nikki Mills out of Australia did her PhD study on tongue anatomy or lingual anatomy, and she says this in her study, which the reference is right there for those of you that want it. There is extensive variation between individuals in the appearance of the lingual frenulum, but an ambiguous relationship between that appearance and functional limitations. So what does that mean? That means that there's a big variety of what it looks like, but not necessarily a correlation to how it functions. She goes on to say an increasing number of infants are being diagnosed with ankyloglossia with growing uncertainty regarding what can be considered normal lingual frenulum anatomy. Okay? Now, in my mind, the bottom line on this subject and how I explain this to all of my patients in practice every day is this. The tongue is like any other muscle. In fact, there's 8 muscles that make up the tongue that allow it to move in all the different directions that it needs to move. And guess what? Like any other muscle, those muscles are attached to the bone. In this case, the muscles that make up the tongue are all attached to the cranial nerves. And if you can see my little diagram here, they're attached to what's called the temporal bone. And if we look at my little baby skull here, the temporal bone is part of, let's see, right there is making up part of the jaw. It's also attached to the interior of what's called the mandible or the chin. And then there's a floating bone right here called the hyoid that is in front of the upper neck. As a good friend of mine, Dr. Andrew Doro, has said in his classes, if your baby is twisted and turned like so, it's going to be really hard for them to breastfeed, do you think? So the structure absolutely determines how those tongue muscles work. Okay, if your baby looks anything like these babies, and all of these pictures have different misalignment patterns, misalignment that happen during the birth process as the cranial bones shift in different places, then you can be sure that all of those muscles and the nerves that allow the muscles to work right are being compromised. Now, I should say before I'm done here, I still believe that the surgical release of a tongue tie is very helpful in some cases. I just want to address the foundation first. Now, if you thought that this was interesting, then I invite you to check out my website called The Anatomy of Breastfeeding. It's at thegoodlifelearning.com, and there's a free about 45-minute class in there called Breastfeeding Made Simple. There's the QR code. It's my gift to you. Please look at that, and you can dive into all these subjects a lot deeper. And if you happen to be in the greater Sacramento area, I would love to take care of you and your baby in my clinical practice. My information is right there. Look for me in future videos, and thank you for joining me. Bye-bye.